Let's start with a big question. Does your personality type actually affect your risk for addiction? While there's no single addictive personality, certain personality traits, like impulsivity or emotional sensitivity, can increase the likelihood of developing a substance use disorder. And although addictive personality disorder isn't a formal diagnosis, understanding your personality type can give you powerful insight into how to avoid addiction or how to seek help if you're already struggling. In this video, we'll break down these topics: the Myers-Briggs personality types most prone to addiction, other common addiction risk factors, why people struggling with addiction may lie, how to protect yourself, and what to do if you or someone you love needs help. Personality isn't destiny, but it can shape our behaviors in surprising ways. The MBTI test, though not used clinically, has become a popular way to understand personality through 16 distinct types. Emerging studies suggest that some of these traits may correlate with a greater risk of addiction. Here's a closer look at the patterns researchers are beginning to see. ISFJ, the caregiver. ISFJs are thoughtful, dependable, and deeply caring, but that people-pleasing nature can sometimes come at a cost. They may suppress their own emotions, avoid seeking help, and take on others' burdens, all while turning to substances in private to cope with stress. ISFJs also tend to fall into codependent relationships with people who struggle with addiction, which can slowly drain them, emotionally and physically. INFJ. The idealist INFJs are introspective perfectionists. They crave meaning and purpose, and often hold themselves to very high standards. But when life doesn't go as planned, that pressure can turn inward, leading to anxiety, burnout, and self-doubt. Substances may become a secret way to numb the pain or maintain a false sense of control. Because INFJs tend to function well outwardly, their addiction may go unnoticed, even to themselves. INTJ, the strategist. Analytical and driven, INTJs are used to doing things their way, and doing them well. But that desire for control and avoidance of vulnerability can make it difficult to ask for help. Instead, they may turn to substances to self-regulate emotions or cope with pressure. Like ISFJs, INTJs may also end up supporting or enabling a loved one's addiction to keep up appearances. ESTP, the risk taker. ESTPs love action. They're social, impulsive, and thrill-seeking, which means they might experiment with substances without thinking through the consequences. Their constant need for stimulation and excitement can spiral into risky behaviors and increased addiction vulnerability. ISTP, the problem solver, logical and independent. ISTPs excel at analyzing systems, but not always at processing emotions. They may bottle things up and turn to drugs or alcohol to escape feelings they don't want to deal with. Their independence makes them less likely to ask for help. ISFP, the sensitive soul. ISFPs are artistic, gentle, and peace-loving, but they tend to avoid conflict and confrontation. This can lead them to internalize stress and pain. When they lack emotional outlets, substances may feel like the only escape. ESFP, the life of the party. Outgoing and attention-loving, ESFPs thrive on connection and approval, but that need for validation makes them vulnerable to peer pressure. They may use substances to impress others, fit in, or avoid rejection, even if it leads to unhealthy habits. ENFP, the explorer. ENFPs chase excitement, creativity, and spontaneity, but their constant search for novelty can lead to experimentation with substances and emotional crashes when reality doesn't meet expectations. Now, let's zoom out. While personality plays a role, here are other common risk factors that influence addiction. Upbringing, exposure to substance use or trauma in early life. Genetics, family history or low dopamine receptor count. Environment, easy access to drugs or living around substance use. Mental and physical health, anxiety, depression, or chronic pain. These risk factors, combined with personality traits, can make some individuals more vulnerable than others. Now let's talk about one behavior that's hard to understand from the outside: lying. Why do people with addiction lie? It's not usually about manipulation. It's about shame, fear, and survival. Addiction rewires the brain's judgment and impulse control. People may lie to hide their use, protect access to substances, or convince themselves they're still in control. The good news? As healing begins, honesty often returns, especially with the right support. Being at risk doesn't mean you're destined to become addicted. Here's how to lower your risk. Avoid high-risk substances. Watch for signs of dependence like cravings or withdrawal. Seek help early, before things spiral. If you or someone you care about is struggling with addiction, you're not alone. Professional help is available, and recovery is possible. Visit detox.com or call our helpline today to connect with programs that match your needs and personality. The first step starts with reaching out.